Hi, I'm Jeannie Faulkner. So this week we're going to talk about healthcare headlines in the news. And I was going through a trove of health-related headlines today, looking for women's and maternal health issues to write and talk about. And it struck me that all I was going to get by going that route were finding medically slanted, study-oriented stories about what scientists and doctors have learned this week about healthcare. And while it's always fascinating to me to see how the medical community is addressing common and not so common health problems, it's also very enlightening when you realize most of our research dollars are going to study health problems that are largely self induced and, with the right kind of support, could also be self controlled. That is, if people and communities focused on supporting what makes us healthy instead of relying on healthcare to patch up what makes us sick. So, here are just a few of this week's headlines that underscore my point. E cigarette poisoning on the rise. FDA approves easy to use autoinjector for heroin overdoses. Young insomniacs face skyrocketing stroke risks. Diet supplement causes nearly 100 cases of hepatitis. Obviously, there are dozens of these stories every week, and each article is based on a study of people who are using e-cigs or heroin or not getting enough sleep or taking pills to lose the pounds. And whenever I read these things, I'm struck that most of us with an ounce of common sense know that nothing learned in these studies is going to really solve the health problems if the real stakeholders, people like you and me, don't take the reins on staying healthy. The answer to making e cigarette and heroin users healthier doesn't lie in the study results. Everybody knows tobacco in any form is a killer, and that heroin use is quickly addicting and can just as quickly kill you. Insomniacs aren't getting any better sleep knowing that their sleepless nights may be putting them at risk for stroke. Obese people know that taking diet pills is not the answer to their overweight problems. So instead, what if we funded studies that supported the real answers to these health questions? What if our headlines were more about real health instead of healthcare and medical studies? Then they might look something more like this. 300 people in one town are breathing easier today after celebrating their first month as non smokers. Counseling services and affordable housing for veterans, youths, and the homeless have resulted in 500 fewer cases of drug addiction this month. Young people are sleeping better now that they're unplugging from electronics and spending more time playing at the park. Stock prices for drug companies making diet pills plummets as stock prices for fresh produce soars. I was listening to Marketplace on NPR last night, and they were talking about healthcare dollars. A doctor who worked in a clinic for underserved patients was talking about one of the biggest puzzles in the new area of healthcare. How can doctors keep people healthy when they have almost no control over what happens outside the hospital? So they interviewed a woman who runs a nonprofit organization that works with medical providers to connect their patients to social services, things like housing, food resources, utilities, and other basics of life. She gave an example of a patient who came into the hospital to have her diabetes managed, but she needed to refrigerate her medications. She hadn't had electricity for 6 weeks. Many countries that have earned bragging rights because their citizens are overwhelmingly healthy, these governments invest their dollars in social services and in making sure their citizens have access to the real tools of health: healthy food, clean water, education, employment, appropriate exercise, and lifestyles that create well being instead of physical and mental health problems. These governments and countries recognize that education, poverty, and safety have more to do with a population's overall health than medical care does. In these countries, they invest far more on social services than they do on medical care, and the results are staggeringly positive. So, why don't we do that here in the US? Well, that's the political and financial question of the century. And it's no coincidence that the other big headline of the week is about skyrocketing rates of people enrolling in for health insurance coverage to meet the Affordable Care Act's open enrollment deadline. In a country that values healthcare more than health and profits more than people, it's at least reassuring that at least now more people can gain access to healthcare because they can now afford it. The irony of that is that with record numbers of patients now vying for the same services, the medical community is going to have to spend their dollars more wisely, and they're going to have to do that by investing in what really makes patients healthy: food, water, exercise, safe housing, stress reduction, community, healthy relationships, and security. And that's what made it an interesting week in healthcare news. So thanks for being with me. Come on back next week. Bye bye.